Welcome to the New England Journal of Medicine at the annual meeting of the European Society for Medical Oncology. I'm Stephen Morrissey, managing editor, and I'm talking with Eric Rubin, editor-in-chief, and Oladapo Yeku, associate editor of NEJM Evidence. We're looking at a study of Ponsegromab in cancer Cachexia. Yeku, this is a study of a new agent to treat Cachexia. Prior to this trial, what options were available?
So, Steve, other options under the collective umbrella of best supportive care include olanzapine, megestrol, low-dose glucocorticoids, and mirtazapine. However, none of these examples are specifically FDA approved for the management of cachexia.
And Eric, how did this study work, and what did the investigators find?
Steve, in this trial, patients with cancer and cachexia with at least a 5% weight loss and who also had an elevated level of growth differentiation factor 15, or GDF15, were randomized to either placebo or one of 3 different doses of Ponsegromab administered every 4 weeks. The primary endpoint was change in body weight at 12 weeks. More than 180 participants with a variety of tumors were randomized. Weight gain was improved in all of the treatment groups as compared to placebo. During the short course of the trial, there were limited adverse events that could be ascribed to the treatment.
Yeku, besides weight gain, which, as Eric says, was the primary endpoint for the study, were there other endpoints of interest?
Yes, Steve. Weight gain is important, but clinical endpoints such as physical activity and preservation of appetite have a significant impact on patients' quality of life. Although the study duration is short, results from this report are very encouraging, and longer-term outcomes in these domains are eagerly awaited.
Yeku, what kind of follow-up studies would you like to see?
Eric, the adverse event profile for this drug and its method of administration lends itself to combination treatment with some of the other best supportive care treatments we typically use to manage cancer cachexia. In addition, it would be important to explore this agent in other cancer types where GDF15 might play a role. An important point to remember is that we can see cachexia in other non-cancer conditions, and it would be also important to evaluate if drugs that target GDF15, such as Ponsegromab, would have activity in these conditions as well.
Thank you, Yeku. Thank you, Eric. The report of this study is now available at nejm.org.